Hello, Calaveras County. I'm Mike Taylor, and as you see from the beginning of the show, the doctor is in, Dr. Randy Smart. How are you?
Hi, Mike. It's great to be here today. Thanks for inviting me.
You bet. Now this time, Doc, I'm anxious. Got some anxiety.
I know a little bit about that.
How do we deal with that? It seems like such a broad, overarching kind of thing that none of us really know what it is, or maybe which doctor we're supposed to speak to about what.
Or whether you have it or don't have it.
True.
It's kind of a term we throw around a lot, but then, what does that really mean?
Yeah.
And do I have a problem? And, what's interesting, Mike, is most medical disorders are kind of black and white. Like you either broke your leg or you didn't.
Yeah.
Or you either had a heart attack or you didn't. And when you get into behavioral health, and anxiety disorder is in the behavioral health arena, the black and white kind of goes away a little bit. And that's because it is about things and symptoms that are really part of our normal lives. So for an example, you can be depressed, and that can be a normal part of life. That doesn't mean you have major depression or you need antidepressive treatment. And so a certain amount of depression is okay, right? We all probably get that sometime or another.
Yeah.
Well, the same with anxiety is all of us will get anxiety at one time or another.
Sure.
And some anxiety symptoms are okay. And as you get more and more of those, you are then maybe afflicted or have a problem with anxiety disorder or severe anxiety disorder. So having anxiety doesn't mean you're sick necessarily. It doesn't mean you have a problem. But if you have enough of it, you do. And so the black and white goes away in this kind of medical diagnosis. But anxiety is very common. All of us, I think, have had it at one time or another. And anxiety disorder, which we could talk about how that's defined, is when you're when you have a problem. It's a little more than normal. And anxiety disorder, there's some long definitions of it. You have to have symptoms for 6 months. They have to affect your normal, they interfere with your life.
Yeah, your ability to kind of carry out your normal day.
Yes, exactly. Yeah, and kind of the absence of another medical reason to have those symptoms.
Okay.
So what's interesting to me is how common anxiety disorder is. Not anxiety, but anxiety disorder. How common that is. And I would guess most people, or many people that have it, have never really been diagnosed with it and may not know that.
I was going to say, maybe the best thing for us to do is when we start talking about anxiety disorder is what are we looking at? How does that manifest in, we can sit there and be anxious, as you say, maybe before giving a speech or before a performance of some kind. If I was going to sing the national anthem before a ball game, I'd get really nervous too, and that's anxiety, but that's not the kind of thing we're talking about here, is it?
Well, not exactly. So people with anxiety disorder often, actually 30% of the time, will have also some sort of phobia. Okay. And a phobia is an irrational fear of something. Like a common one is claustrophobia. You don't like closed spaces, you have panic attacks. Another is fear of flying, lots of that. The one you alluded to has a really interesting name. It's called glossophobia. Glossophobia is sort of what you would think of as stage fright.
Okay.
But people with anxiety disorder are much more likely to have phobias.
Okay.
But you can also have that phobia and not have anxiety disorder. So there is a link, but it doesn't necessarily mean you're sick.
Okay.
So right. So how do you know you have it? Doc, do I have it? So many of the things we do now, what is it, 2019, there's an X-ray. Well, not for this.
No.
Or there's a blood test. Not for this. So this is one of those medical diagnoses that's made in an office. And actually, I would say the majority of it is made in a primary care office as opposed to a psychologist, psychiatrist,
I was going to ask
social
that.
worker.
So
Sure,
this is
just
a
by
medical doctor.
By your regular doctor,
Okay.
right. Most of us are trained to recognize it. And anxiety disorder is very common. It's reported 10 to 12% of people have anxiety disorder. So in this county, what would it be, 4,500 people
Yeah, something like that.
have anxiety disorder? So that's a lot, right?
Yeah, it is.
Right. I mean, that's a whole town.
Yeah.
Right. So there's probably a lot around us. I know in my practice in Murphy's, gosh, I would see it every week. Maybe even every day, it seemed like sometimes. So it's very, very common. But then again, back to your question. How do you know you have it, right?
Yeah.
So anxiety disorder is the feeling of apprehension. It is excessive worry, like worrying,
Okay.
kind of worrying about things that haven't even happened and probably won't happen. And enough apprehension and enough worry that it starts interfering with your life. Like you don't sleep well, or you feel tired all the time. And then what patients with anxiety can do, in the medical world we call it somaticize. Have you heard of somaticize before?
No, I haven't.
It's a $20 medical word. So somaticize means because you have something going on up here, it manifests somewhere in here.
Oh, really? Okay.
And so an example of that is if you had anxiety disorder, you could have chest pain.
Oh, okay.
Okay? And so you could be a 20-year-old with chest pain, and in many cases in a 20-year-old, that chest pain would be related to anxiety disorder.
Wow.
There's
okay.
other causes of chest pain, of course. But some of the somaticizing would be chest pain, palpitations, fast heartbeats. Could be dizziness, could be pain. Anxiety patients tend to have more pain. I don't think they have more pain. I think their pain thresholds change. That's personal opinion.
You think they get more
I think they're more
susceptible to
yes.
it? Or okay.
So if you have a shoulder problem, and maybe it doesn't bother you too much, but you have anxiety disorder, you're not sleeping well, you're kind of getting run down, your shoulder's going to hurt you much, much more. So the anxiety disorder patients have much more pain. One of the most common are headaches.
Oh, okay.
They have a lot of headaches. They have neck pain.
Because of the tension, I would imagine.
Probably, I would guess. And they have shoulder pain.
Okay.
Right? More tension.
So, kind of locks everything up. Now, where do we get from the point that this is something that you're not worried about to where, and I guess maybe you can give us some examples of how this manifests in ways that it is affecting. You mentioned losing sleep or not sleeping as well, but I would think that during the course of the conversation with your physician, he or she would kind of unearth your anxiety in the course of that insomnia discussion, it would seem to me. Is that?
Probably.
Okay.
If they're doing their job right, probably. But other ways it can interfere with your life is it affects your concentration because you don't, partially because of lack of sleep, but partially because you're anxious. Your concentration is impaired, so that can affect work performance. It can actually be a safety issue, if you're maybe in law enforcement or public safety, it could be a safety issue. And it can. I have seen patients with anxiety disorder that were in their car, and their anxiety was building rapidly, and part of it was related to driving, but And they ultimately ended up on the side of the road and couldn't get out of the car.
Wow, okay.
And had to call, and then ultimately law enforcement called us and said, what do you know? But it can be seriously disabling, Mike. Very disabling.
How do these folks usually present to a physician? Is it listing off these other symptoms, or they just say, I can't calm down, I can't get my head to quit working?
I wish they would present that way. Some do. Some self-identify and say, Doc, I'm anxious, I worry all the time, or my husband is anxious. Whereas some of that happens, but many times they will present with a symptom or a problem that they don't tie to the anxiety.
Oh, okay.
And they'll say, look, I'm just tired all the time. And then with the appropriate questioning, you get back to the anxiety.
Sure.
But more often in my field as an internist, what I will see, chest pain is very common.
Okay.
And it typically is a younger person with chest pain, doesn't always have to be.
Who wouldn't think he or she would be having chest pain, so I would think, yeah, I'm going to mention that to my doctor.
Right. They come in and say, look, I'm having chest pain. My neighbor thought it was a heart attack.
Yeah.
What do you think? Shortness of breath is very common.
Oh, okay.
People that have, some of the patients with anxiety disorder will have also what's called panic attacks. And so, it's kind of intuitive, but panic attacks are discrete episodes of suddenly heart beating fast, can't breathe, don't feel good, standing in line at the bank, what do I do? I think I'm going to pass out. And so those panic attacks have a lot of these somatic symptoms, chest or stomach or breathing. And so they end up in our offices to find out what's causing their shortness of breath.
That other symptom.
Yes, exactly.
Okay.
Yeah, so often they present that way. But one of the interesting ways they present, and some in the audience are going to hate this, but one of the red flags for anxiety disorder is somebody who has frequent recurring appointments for symptoms we can't figure out.
Oh, okay.
Right? And I know some in the audience are going to hate me for saying that, but it's actually true. And I look for that. I don't immediately jump on anxiety because there's lots of reasons that can happen. Maybe a misdiagnosis or maybe there's lots of reasons. But one of the things you think about is maybe there's some anxiety here. So and I saw a patient like this last year that I thought was really interesting. And she had just had a number of tests and appointments and different doctors, had been in the valley, had been all over the mother lode. And she came in sort of as a referral. And probably 20 minutes into the appointment, I said, you have anxiety disorder. And she says, I was wondering about that. I thought that might be part of this, but nobody's ever mentioned that before.
Are these patients usually, I guess I'll say, aware that this is what's going on, that they're having anxiety, or no?
No, I wish they were, but we are one of our strengths, maybe, or weaknesses, is that we are super well defended, and so. We always have an explanation for what happens. And my chest pain is because I have a heart problem. I'm telling you right now, I have a heart problem. Or my shortness of breath is because I have asthma and I was exposed to something when I was a child. And so they don't really make that connection.
Okay.
But part of the problem is it starts with a somatic symptom. And you think, well, I'm not crazy. I have chest pain.
Yeah, something's going on with my heart.
Right, exactly. And it's really hard to get them back to say, wait a minute, let's go back to the beginning. Maybe this isn't about your heart.
Yeah.
And you can do that. It takes some time. But they can be very well defended, and some of them are offended by when you
The
bring up
suggestion that you're bringing up
you
mental
bring
health.
up anxiety, and they go, wait a minute.
Well, isn't that part of our problem here, especially in the United States, that if you use the MH words, mental health, everybody seems to freak out?
Right.
We're trying to get better at it, and we talk a lot about being more understanding and realizing that much larger percentages of our population have a lot of these maladies that we classify under mental health.
Right.
And anxiety, it seems to me, is kind of one of the primary among all of these.
Absolutely.
And so how do we get from, I've come to the doctor's office, I guess, where do we go now what do we do to treat this? Is it start therapy sessions, or is it medications? Where do we go to fix it?
So here's the good news. There's good news and bad news here, right? The good news is this is very treatable.
Great.
The bad news is it tends to be a chronic illness that sort of fluctuates, and you can have a good year, a bad year, a good month, a bad month. You can have triggers. And I don't want to say it's a lifelong problem, but it's typically not a short-term problem. It tends to occur more in women. There just seems to be a genetic component.
Okay.
Not well figured out yet. People that are shy tend to have more of this.
Okay.
The elderly tend to have more of this, and there's an important point here, is you can say, well, I'm 30 or 45 or whatever, and I don't have it, so I never will get it. Not true.
Not true.
Not true,
No.
right. So you can develop anxiety disorder as you age. So the good news is it's very treatable. The bad news is it's probably going to be in and out of your life as you go along.
It's going to be treatable for a while. Now, so does that mean we end up with medications, or where does it go treatment-wise?
So the first thing is sort of the idea of acceptance, that this is what I have, and I'm, and sort of some insight that the reason I can't breathe is because I'm having these panic attacks and I'm having anxiety. So that's really key, Mike. And however much time it takes me to sit down with a patient and make sure they're comfortable with that is worth the time. Second is there are other things that can mimic anxiety, like thyroid disease can do that.
Oh, okay.
Too much caffeine. You know how kind of our younger generation is pounding these energy drinks?
Yep.
You can be doing that and have anxiety symptoms and it's the caffeine. It's nothing else.
That's why I don't drink them anymore.
I saw too. Right.
When you get the one that has too much caffeine in it and it sends your heart into overdrive,
Then
you think,
go,
okay, I'm
bad
done
idea.
with those. Yeah.
Alcohol can mimic anxiety disorder. So as a physician, I want to make sure it's not all those things. But then let's say, you're the 10%, you've got it. There's kind of a what do you do if you're in the middle of the line in the bank and you're short of breath? Well, we teach them to do things that help them focus on something else.
Okay.
Deep breathing. So just slow, deep breaths. And it kind of distracts the brain from the anxiety. The other is counting. You can count to 10. You can count backwards. You can count to 20. You can count backwards. But those distractions really can be helpful in aborting the kind of a panic attack. What's interesting to me is snacking tends to help.
Really?
Yeah, and
Wow.
so
the one moment when a snack.
This is the only show we'll ever do where I tell you to eat. The only one.
Snack.
So snacking appears to help.
And is that because it kind of makes us comfortable and get back into ourselves a little bit, maybe?
Do not know. don't know, but I think
Yeah.
it's very interesting. So, to have some lifesavers or, maybe something a little healthier, and that would be like a granola bar. But, something if you have anxiety disorder and you have panic attacks, to have something like that you can, pop in and snack a little bit. But then okay, so you got through the bank line, now you're back home, and you go, well, this is going to happen again sometime in my life. What do I do? So exercise helps.
Naturally.
Regular healthy eating helps. Good sleep patterns help. And then eliminating the caffeine and the alcohol. But those things can be very helpful. And notice we're still not to medications yet.
Yeah, we still haven't gotten anywhere near the pharmacy.
So one of the most helpful things, if you need to go beyond that, is our psychologists. Now, the psychiatrists are the medical doctors, kind of serious.
I always forget which one can prescribe and which one can't. That's how
That
I
would be
always
the psychiatrist.
Okay, the psychiatrist.
And the psychologist is not a medical doctor, but it's somebody with a lot of training and a graduate degree. And what they tend to focus on is called cognitive behavioral therapy.
Okay.
And that's when they say, okay, let's talk about these symptoms and what they mean and why you get them and what you can do about them. And they kind of get you to a place where, let's say it's claustrophobia and you can't go in the elevator. They can get you to a place where you can start doing that.
Going into the elevator.
Yeah, exactly. Yeah. So the psychology thing is really, really helpful. What tends not to work is not doing anything.
Yeah.
If you don't do anything, this is not going to go away. And unless you're drinking a lot of caffeine or something, it's not going to go away. So making your own lifestyle changes can be really helpful. And then working with the psychologist can be really helpful.
Does he or she start to identify kind of what might be triggering your anxiety so that getting in the car and the person who had to pull over, so that before you get to that meltdown, the anxiety attack, so that you can, I'm starting to think that way.
Absolutely. That's what they do. They say, why, fundamentally, why are you having these symptoms? And often they can tie it to behavioral things you're doing, or even some historical things. Now, if you want to go really deep, you go to a psychiatrist, and they do something called psychoanalysis. That's the thing on the couch, that takes all afternoon and every week, and you become friends and all that kind of. Right. But let's say those simple things aren't working. There are medications that are very effective. And most of those medications are prescribed by primary care doctors.
Okay.
So it's not like you need like this super specialized care at one of the universities. That's not a bad idea if you have access to those resources.
Sure.
But if you're the average person in Calaveras County and you want to just see your regular primary care doctor for anxiety disorder, you've been through the simple things, there are some medications that are very effective, Mike.
With the primary care physician, have we skipped a step, though? If that physician prescribes medication, and the reason I'm asking is because you brought up going to see the psychologist. Excuse me, I knew I was going to goof those up. You go to see the psychologist, and you get some of those tips or tricks. That seems a really lame way to talk about it, but you get those ideas on how to shift your thinking and stop yourself from heading down that anxiety-laden path. By just presenting to your primary care physician, is he or she going to lead you into that road, or is he or she going to say, here's a prescription, get rid of your anxiety?
Yeah. Do you have any easy questions?
I'm terrible with anxiety, aren't I? I'm giving you anxiety.
You are. So it would depend on practice style and available resources. If you were to come to my practice, It would have been both.
Okay.
I would have said, look, I think I can explain this. I think you have anxiety disorder, and get to the point where they accept that and are willing to do something about it. And some of the lifestyle changes and acute interventions I can help them with. But almost always I recommend that they see a psychologist, and I refer them to one. Now keep in mind, the psychologist doesn't have a prescriptive authority, right?
Yeah.
So often it's kind of tag teaming, and the psychologist really works on the non-prescription intervention. And as they come back to me, many times the psychologist will call and say, I think we should think about some prescriptions.
Okay.
And so I say, great, I'll prescribe the medicine I think is right. This is what I'm going to use. You continue to see the patient. We'll continue to talk. And that's the way the world should work.
It sounds like rather than showing up to the doctor's office and mentioning that pill that was prescribed on television, maybe you ask him or her, I'm having these symptoms. Have I got anxiety disorder?
Yes.
And then you kind of move from there. And then I would think it's ask questions time. I mean, once you and your doctor decide that that's what's going on, I would think that it's talk time.
Right.
It sounds like it.
Right. It has a lot to do with education, insight. And it is interesting. Many more of these patients than you would guess agree. When you get to that point and you say, look, I think this is anxiety disorder, they go, that's what I thought it was.
Oh,
that's
okay.
exactly what. Yes, exactly.
But they didn't bring it up at the beginning of the appointment.
Right, and you would think the majority would go, no. I know something's wrong. You need.
Yeah.
But many of them agree, and they say sure.
Okay.
And I would say over half require no prescriptions at all.
So it's just learning those
Understand what I have,
tips and tricks and
what I can do and can't do,
ways to shift.
some lifestyle changes. Right?
We're in about our last minute, so
No.
it sounds. I know we
It's giving me
breezed through that.
anxiety.
I know. So it sounds like you just need to not be afraid to ask somebody.
Yeah, you need to realize this is a fast-moving world. There's more information out there than there's ever been, and frankly, there's more stress.
Yeah.
And you probably have anxiety disorder. Many people do, and there's lots you can do about it.
There's lots of help.
Yeah, there's
That's
lots you can do about it.
And with all that help out there, we got a little bit of it today from Dr. Randy Smart. Dr. Smart, thank you very much.
Thank you, Mike.
Until next time, ladies and gentlemen, I'm Mike Taylor. The doctor is out. Be healthy.